We noticed a drastic drop in calls to the Child Protective Services hotline. To give you an idea, the first week in March, we got 438 calls, and which was normal. That was kind of the usual flow of calls. And by the last week in March, when schools were closed, we only received 125 calls. And it's been pretty steady, that amount since then, between 100 to 200 calls. So we knew that the majority of our calls come from the schools. They're the people that have the most consistent interaction with children. They're able to see them the most, see what's going on with them. So we knew that with school shut down and children not being seen by their normal supportive adults in the schools, added to all the stressors that came along with COVID. So families concerned about their health, families concerned about loss of income, loss of employment, potential loss of housing, increased stressors also increase the risk of family violence. So we knew that this was kind of a perfect storm, and we're really worried about kids. Some potential signs that you want to look for when you're interacting with a child or a family, either virtually or in person. There's some specific things that you can be looking for, just kind of have those on top of your mind. And one would be the parent or caregiver's behavior. So if they're seeming very overwhelmed, if they're threatening a child, berating them, making hurtful remarks, that might be a clue for you that something's going on there and that parent might need some more support, and that child may be at risk. Some things for the child, looking at their physical appearance. So again, this may be more in person, things like unexplained bruises, welts, marks, burns, things like that. If the child appears to be undernourished, so they look like they've lost a lot of weight. In terms of a child's behavior, changes in mood. So sudden lack of engagement, things that they used to be really excited about, now you're not seeing that. Crying uncontrollably, appearing to be withdrawn, appearing to be fearful. You would call 911 and not Child Protective Services if a child is in immediate danger or is under the age of 7 and is alone. 911 is able to get there much faster than Child Protective Services is, and they will alert us as well. So that's better to ensure an immediate response. If you have concerns about a child's safety more in general, please call the Child Protective Services hotline. That number is 703-324-7400, and that number is answered 24 hours a day, 7 days a week. You can make a report or discuss your concern. It doesn't have to necessarily be a report. You could just say, hey, I'm concerned about this, and someone will talk that through with you. You can also make calls anonymously. If a child does disclose something to you, the number one thing you can do is listen. Be there for that child. Tell them you care, you want to help. Let them know they're not alone and this isn't their fault. Don't get into a lot of questioning them about it. Just let them talk and let them know that you're a safe person to talk to.